your thorax and lungs today. So could you help me with your name?
Myself, THAKUR.
Okay, your age?
19.
Okay, so let's start the examination.
Begin the examination by identifying the sternal angle. Place your fingers in a hollow curve of suprasternal notch and slide your fingers downward until you feel the bony ridge that joins the manubrium to the body of the sternum. Move your fingers laterally and find the second rib and walk down for the interspaces. Begin with brief survey of respiration and thorax. Note the shape of the chest and how it moves. Look for asymmetry and deformity. Observe for the rate, rhythm, depth and effort of breathing. And listen for any audible sound of breathing that may indicate respiratory distress. Listen and count the number of breaths per minute. Normally, the resting adult breathes easily, quietly and regularly about 15 to 20 times a minute. Palpate the sternal notch to check the position of trachea. It should be in midline. Check the patient's color and fingernails for cyanosis or pallor, a bluish color arising from deoxygenation. Examine the posterior thorax. Start with inspection. Observe the chest for symmetry and deformities. Palpate the chest. Look for tenderness or bruising. Assess any skin abnormalities such as masses or sinus tracts. To test for chest expansion, place your thumbs at about the level of the 10th ribs with your fingers loosely grasping and parallel to lateral ribcage. Ask the patient to inhale deeply. Watch the distance between your thumbs as they move apart during inspiration and feel for the range and symmetry of the ribcage as it expands and contracts. This movement is sometimes called lung excursion. Palpate for tactile fremitus. To detect the fremitus, use either the ball, the bony part of the palm, to optimize the vibratory sensitivity of the bones. Ask the patient to repeat the words 99. Identify and locate any areas of increased, decreased or absent fremitus. If fremitus is faint, ask the patient to speak more loudly or in a deeper voice. Continue the examination by percussing the chest in systemic manner. Ask the patient to keep both arms crossed in front of the chest. Percuss one side of the chest and then the other at each level in a ladder-like pattern. Identify and locate the area and quality of any abnormal percussion note. Ask the patient to breathe out and use percussion to identify the lower level of the diaphragm. Auscultation is the most important examination technique for assessing airflow through the tracheobronchial tree. Listen to the breath sounds with the help of your stethoscope. Use the ladder pattern suggested for percussion, moving from one side to the other and comparing symmetric areas of the lungs. Note the intensity of the breath sounds. If the breath sounds seem faint, ask the patient to breathe more deeply. Listen for the pitch, intensity, and duration of the inspiratory and expiratory sounds. Listen for any added or adventitious sounds such as crackles, wheezes, and ronchi. To check for bronchophony, ask the patient to say 99. Normally, the sounds transmitted through the chest wall are muffled and indistinct. Louder voice sounds are called bronchophony. To check for egophony, ask the patient to say E. You will normally hear a muffled long E sound. If E sounds like A, an E to A change or egophony is present. Ask the patient to whisper 1, 2, 3. Louder, clearer whispered sounds are called whisper pectoriloqui. To examine the anterior thorax, have the patient lie supine and breathe normally. Observe the shape of the patient's chest and check for any deformities or asymmetry of the thorax. Look for local lag or impairment in respiratory movement. Palpate the anterior chest wall, identify the tender areas or assess bruising. For assessment of chest expansion, place your thumbs along each costal margin. Ask the patient to inhale deeply. Observe how far your thumbs diverge as thorax expands. For the assessment of tactile fremitus, use the ball or ulnar surface of your hand. Fremitus is usually decreased or absent over the precordium. For percussion, use the ladder pattern. Percuss the anterior chest, again comparing both the sides. Identify and locate any area with an abnormal percussion note. Listen to the chest anteriorly, compare symmetric areas of the lungs. Listen to the breath sounds, noting their intensity and identify any variations. Identify any adventitious sounds. If indicated, listen for transmitted voice sounds. Record your findings. This ends the video.